Welcome to the Category A home study, Bridging the Gap Between Healthcare and Strength and Conditioning. My name is Megan Hunt. I'm the Vice President of Precision Athletic Training. We have been an athletic training contracting and consulting firm since 2009 and have been offering continuing education and CPR recertification for athletic trainers since 2013. Along with the link to this video, you will have received an evaluation form and an assessment form. Please complete those at the end of the webinar and return them to me at mhunt@precisionat.com to receive your statement of credit. Our presenter today is Jonathan Williams. He is a certified athletic trainer, certified strength and conditioning specialist, and USA weightlifting sports performance coach. He also holds a master's degree in exercise physiology. John has 6 years of clinical experience working with various institutions and various NCAA levels. He is currently the athletic trainer and strength and conditioning coach for the men's ice hockey team at Endicott College. In his current role, he incorporates injury prevention techniques on a regular basis. He identifies areas and situations where particular techniques have been found to be successful and others where there has been little clinical advancement. Without further ado, Jonathan Williams.
Well, thank you for having me. I really enjoy being a part of this whole process. So bridging the gap between healthcare and strength conditioning, evidence-based injury prevention, and return to play considerations. This was a topic that I became really passionate about when I got into strength conditioning. I started to see that as I was working in strength conditioning and athletic training at the same time, that we started to be able to decrease the injury rates when I was really working together between both fields. So this idea of bridging the gap and trying to spread information between the two fields is something I became really passionate about once I got into both fields. So a little bit about myself. I have a Bachelor of Science degree in athletic training and sports medicine from Quinnipiac University, a Master's of Science degree in exercise physiology from the University of Mississippi, where I was a graduate assistant athletic trainer. After that, I spent 2 years as an assistant athletic trainer at UMass Lowell, where I implemented injury prevention techniques in conjunction with the strength conditioning staff. And currently, I'm an assistant athletic trainer and a strength conditioning coach and a preceptor for the athletic training education program at Endicott College. So when I got into my role as a strength conditioning coach and an athletic trainer, I began to view the field as a scale. So the two main points of the scale, one is enhancing performance and the second is injury prevention. So in my current role at Endicott College, probably the two biggest things I have to accomplish day to day is trying to enhance the performance of the athletes and also prevent injury, and they really go hand in hand. So it's really a constant balancing act day to day of trying to balance those two things, and that's really what drove me to want to do this presentation. So the ultimate goal of the two different fields, athletic training and strength conditioning, really the ultimate goal is the same. We all want to see our athletes be healthy, and we all want to see them perform well. I think, in general, there's some disarray between the two fields, or some disagreements between the two fields, where maybe there's a misunderstanding between what the goals of each field are. But really, for me, I think it's when it comes down to it, the goal is the same. We want to see people perform well and be healthy. So I was reading through the National Athletic Training Association website, and I came across Facts About Athletic Trainers, which was posted by the NATA in 2009. And I found this quote to be pretty interesting. The National Athletic Training Association states that athletic trainers specialize in patient education to prevent injury and re-injury. And as this is a presentation that's for athletic trainers, I thought it was really important to point this out, that athletic trainers specialize in patient education to prevent injury and re-injury. So I think the strength and conditioning field in general is starting to move towards trying to prevent injury. There's actually a great quote by Mike Boyle, who's a very renowned strength and conditioning coach. He's worked with the Boston Red Sox. He's worked with the United States Olympic program, where he says that in terms of injury prevention techniques, we really should be discussing, as strength and conditioning coaches, that they really should be discussing that stuff with athletic trainers and physical therapists and healthcare professionals to make sure that everyone's on the same page. So it kind of just goes to further discuss that topic of bridging the gap between the two fields. So the why, I discussed this a little bit already, but healthy athletes are successful athletes, and player development is crucial in the success of college athletes, as I personally am a athletic trainer and strength and conditioning coach in the college field. I think one thing that could cause some of the misunderstanding sometimes is strength and conditioning coaches, and I have a quote on the next page to further discuss this, but they're very passionate about trying to enhance performance and having player development and see their athletes succeed. So here's just a quote I want to read through real quick. It's from Devin McConnell, who is the sports performance coach at University of Massachusetts Lowell, where I previously worked. The college hockey season is the longest sports season in NCAA athletics, lasting upwards of 7 months. Because of this, in-season training is absolutely crucial to the development of the player and success of the team. It is often a big shock to incoming freshmen that the team lifts at least twice a week during the season. Add to that extra training sessions if a player is a healthy scratch during games, or simply because an athlete's physical development is not up to par. On top of that, the best programs don't view strength and conditioning as a separate entity from practice, but rather an extension of the overall development model. So in general, I wanted to put this quote in because I just wanted to show how passionate strength and conditioning coaches are about the development of their athletes. And I think some of the where you have some disagreements is when an athlete has an injury and he needs to have things modified, or he can't do certain things. And the strength and conditioning coach is very passionate about trying to move those athletes forward. So you could see, where you can have where some of those disagreements can come into play, where they're really passionate about trying to keep moving forward, and the athletic trainer wants to take a step back. So I just wanted to kind of give a quote, and so that people can visualize kind of that concept. So the training injury prevention paradox. This was a study by Gavitt. The appropriately graded prescription of high training load should improve players' fitness, which in turn may protect against injury, ultimately leading to greater physical outputs and resilience in competition. So this is probably one of the most important studies of the whole presentation, and I'll further explain this on this next slide where we have a graph. And so what you see is 3 different lines. The bottom line is injuries, the middle line is team overall fitness, and the top line is team performance. And then on the bottom of the graph you see the training load. So what is training load? Training load would mean the practice intensity, the duration of the practice, and then also the training load. So for their strength and conditioning session, their conditioning session and the duration of that. So how intense is that session and how long is that session in conjunction with the practice. And then on the other side, you see low, moderate, high. So that's in relation to injuries, fitness, and performance. And what we see is if you look all the way over to the right side, you see that when training load becomes high and excessive, you see a decline in team fitness and a huge decline in team performance, and you also see a increase in injuries. So that's the reason that's one of the most important concepts in this whole presentation, is that I'm going to talk about some different exercises that strength and conditioning coaches use and different theories that strength and conditioning coaches have, but there's really no perfect theory, number one. And number two is, no matter what, if you get into an area where your training load is excessive, whether you're doing all injury preventative stuff or all just trying to enhance performance stuff, when that training load becomes excessive, or you could be doing the perfect strength and conditioning program, and if the training volume for the practice is excessive, like teams are practicing twice a day, 3 times a day, and that load is excessive, there's going to be a decrease in fitness, an increase in injuries, and a decrease in performance. So it's not always just in terms of what's going on in the strength and conditioning session. Sometimes it's related to the practices and what's going on in practice too. So what are the objectives of the study? Review the literature related to techniques, exercises used in injury prevention and return to play programs. Understand the role of injury prevention techniques in relation to reducing the risk of injury. Evaluate ways to implement injury prevention techniques within a strength and conditioning program. Recognize misconceptions in Olympic weightlifting. Obtain knowledge of pre-participation movement screens and their potential uses based on current literature. Improve communication between coaches and clinicians. Assist clinicians and coaches to evaluate and choose best practices for their athletes and patients. So the key points. This presentation is going to be broken up essentially into 2 sections. One is how to enhance performance while also preventing injuries. So one is essentially about enhancing performance, and then the second is return to play consideration. So after someone's been injured, what can I do to help them return to play safely while also, either increasing their performance or allowing them to train safely. So in the enhancing performance side, are single leg squats beneficial? Do double leg squats make you stronger than single leg? What is core strength? How can movement screens help me? Are injury prevention programs really worth it? And then on the return to play consideration side, how can I strengthen my legs without a barbell? How do I stop having low back pain? How do I train my upper body after a shoulder injury? And I am 8 months post-op ACL surgery, what do I do now? So my hope is that at the end of this presentation that you have a little bit of a better idea to take the evidence from this presentation and answer some of these questions. So for strength conditioning sessions, this was a meta-analysis that was done across the country in the United States by the National Strength Conditioning Association. And they looked at injuries during strength conditioning sessions. And the most common were low back pain, erector spinae strains, and knee pain. So those were the 3 most common injuries that they saw across the board in strength conditioning. And interestingly enough, depending on what level the athlete is at, whether it's a high school or Division III athletics or club sports or Division II, Division I athletics, there's many strength conditioning programs that are just run by sport coaches, and that is often at a high school level or potentially Division III or club sport level, where those are not run by certified strength conditioning coaches necessarily, but it may be run by sport coaches because that's all they have available to them. But what they found was that sessions that were run by certified strength and conditioning coaches, the injury rate was decreased compared to those sessions that were run by just sport coaches themselves. So first we'll go into athlete return to play. So what are some common techniques that would be used in a strength and conditioning session when an athlete is getting ready to return to play? So just to clarify, this is an athlete was injured, they have a strength and conditioning session that's a part of their team, and let's first get an understanding of what they're going to be doing in the weight room, and then we can make some adjustments or changes so that they can safely perform those exercises and return to play. So what are some common techniques? You have back squat, front squats, deadlifts, trap bar deadlifts, rear foot elevated split squats, single leg squats, split squats, and lunges. So first thing we'll go over is the back squat. And I just want to comment real quick. When I talk about back squatting, and I've talked about this with some other clinicians and other coaches, and I found this to be a pretty cool picture. You see this particular athlete has a very good range of motion. You can't see the shoes in the picture, but I would guess that he probably has a specialized weightlifting shoe. He's also wearing a belt, but you can tell he has a very good squat form and very good range of motion. This isn't necessarily going to be the case with all of our athletes, and I think it's important to understand that as a clinician and as a strength conditioning coach. So first thing, let's talk about the biomechanics of the high bar back squat and the low bar back squat. So there's two different types of way you can perform the back squat. One is on the left side of the screen, which is called the high bar back squat, and that's when the bar will sit on the top of the top of the shoulder, basically right over essentially your upper traps. And the second is on the right side. It's referred to as a low bar back squat. This is also referred to as a powerlifting squat because you see most powerlifters and powerlifting meets will perform the squat this way. This is when the bar will sit more on the lower traps. And so what's the difference between these two methods? So first we'll talk about the high bar back squat. You can see on the high bar back squat that you have a decreased angle of the hip and spine region, but then you also have an increased angle at the knee region. So what does this do in general? So what this does, it puts a little less load on the hip region compared to the low bar back squat, but it puts a little more load on the knee region compared to the low bar back squat. And the load in this particular study was measured in Newton meters. So having an increased load on the hips allows you to lift more weight because the hips and the spine are a much stronger, stable joint than the knee is. So you can lift more weight with the low bar back squat, which is the reason why powerlifters just choose the low bar back squat, because in a powerlifting style meet, you're trying to lift the most weight possible to win your meet. So they will choose that low bar back squat because that puts a little more load on the hips and the back and trying to lift more weight. Now, that can also be a negative because putting more load on the hips and the low back can lead to a hip or low back injury. Versus, I would say you see a lot of athletes or Olympic weightlifters use the high bar back squat, where you're putting a little less load in the low back, and you end up getting a little bit more on the knee, but and you end up probably lifting a little bit less weight in the low bar back squat. And then for some considerations between the two, like when would I use one versus the other? For the back squat, whatever, some pros, it is recommended that the athletes achieve a full range of motion to get the full benefit. That was by Contreras et al., where they looked at EMG studies of the depth of the squat, and they found that you have increased glute med activation with deeper squatting. So that's compared to someone not squatting 90 degrees versus someone squatting below 90 degrees. Back squats have been found to elicit more semi-tendinosus activity compared to other squats. So and that was a study, EMG study by Gullett and his team. So there is a theory out there among many strength and conditioning coaches that back squats elicit more hamstring activity compared to any other type of squat, whether that be a front squat, split squat, etc. I think the EMG studies have shown this isn't necessarily completely true. As far as the biceps femoris goes, which the biceps femoris being kind of one of the major hamstring muscles. However, there is some evidence to say that the semi-tendinous activity is more with the back squat compared to other types of squats. So I think it's important to clarify that, to just say in layman's terms that, well, if you do back squats, you'll have more hamstring activation. Well, it won't be in the biceps femoris, which is, I think, oftentimes the muscle that we see strained among athletes. It's more in the semitendinosus, which is still important, but it's important to distinguish between the two of those. So what are some cons of the back squat? There was greater range of motion in the lumbar region compared to front squats and the RFE split squat, and this was a study that I'll talk about a little greater detail later on in this presentation by Spears and his team. It was actually probably one of the most interesting studies I read in the whole presentation. And we'll get into that a little bit later. A greater force on the hips compared to the front squat. So as I mentioned earlier, you saw, especially in that low bar back squat, that increased loading on the hips with that increased angle. Greater activation of the erector spinae compared to the trap bar deadlift. And that was an AMG study done by Young and his team, where they compared trap bar deadlifts to the back squats, and we'll talk about trap bar deadlifts a little bit later in this presentation as well. And going back to that kind of initial slide that we talked about with injuries, the erector spinae being one of the most common muscles to get injured during those sessions, if we can, that increased activation of the erector spinae and the back squats, the increased loading of the low back can lead to some of those injuries. So that's an important thing to note. When using force plates, it was found that 60% of the force was produced by the dominant leg and 40% of the force was produced by the non-dominant leg. This would be in a double leg squat. This study, this was a study by Spears, the one that I talked about, the one that I mentioned briefly earlier. But they use back squats. You could infer that any type of double leg squat would elicit this, where the dominant leg produces a little more force than the non-dominant leg. In fact, it's a phenomenon called bilateral deficit. This is this is talked about more often, I think, probably in the past 5-10 years, but it's actually been around for probably since like the 1970s or 80s. If you really go back into research, you can find research that talks about this, way back when, the idea of bilateral deficit, where if you're lifting 200 pounds in a bilateral position, and you're essentially getting, theoretically you should get 100 pounds on each leg, but what we're finding is that may not be the case. You may be getting, say, 120 on one leg and 80 pounds on the other leg of force. Whereas when you do single leg training, you're essentially getting all that loading on that one leg, and then you go to the other leg and get all loading on that leg. So what some of the theories with this bilateral deficit theory is that with single leg training, you're getting more appropriate loads on each leg and having those loadings be the same on each leg. So here's a case. So we have a 19-year-old female soccer player complaining of percent joint dysfunction 3 weeks after his post. Athlete has been cleared to return to play, but still reports minimal signs and symptoms. So this is an athlete who was injured, returned to play. She's going to be in her strength and conditioning sessions and rehabilitation with the athletic trainer or the clinician. She's doing pelvic tilts, dead bugs, clams, bird dogs, angry cats, and donkey kicks and stretching. So those are some of her rehabilitation exercises to increase her core strength. In the weight room, back squats are in the workout. So how are we going to alter that? Replace back squats with front squats to take some of the load off the low back until the athlete reports signs and symptom free. So we'll try and decrease that range of motion in the low back, take some of the loading off of the low back until the athlete is reporting signs and symptom free, and then they can get back into their regular routine. So now I'll move on to the front squat. And again, this picture, this is actually an athlete named Kendrick Ferris, who is one of the best Olympic weightlifters in the United States. In the United States currently, I believe he has competed in the Olympics before. He's always competed on a national level, but I just thought it was kind of a cool picture. This Kendrick Ferris performing a front squat, and you can see again most of our athletes probably aren't able to perform a front squat in this way or with this type of load. You can see he kind of has the perfect range of motion, the perfect front squat. But again, I just thought it was kind of a cool picture to show how, this is the ideal position, but most of our athletes probably aren't able to get this ideal position. So what are the biomechanics of the front squat? So if we go back and compare this picture to what we had in our back squat, we see a decreased angle in the hip and the low back, and that is kind of what we're talking about in our study, in our case study, that you have a decreased angle and a decreased loading on the low back and the hips in the front squat compared to the back squat, which is why sometimes someone with low back pain they may do better with the front squat than the back squat. However, you do see an increased angle in the knee joint, so you have an increased force on the knee compared to the back squat. So that can be, that can be good and that can be bad. With that increased torque on the knee, that could lead to some injuries. So if you have a basketball player or a soccer player who complains of constant knee pain, the front squat may not be the best choice for them. However, in terms of the low back angle and the force in the low back, it would be a better option. So I think it really just depends on your athlete between the two. There's some strength and conditioning coaches and some clinicians who say, they always use front squats versus back squats, and there's different reasons for that. One reason would be that, as you can see, this athlete has the bar in a front rack position. So if they were to get stuck in that position, it's pretty easy for them to just get out of the way and drop the bar without being harmed. Whereas in the back squat, the bar is on their back, and if they get stuck, it's more difficult to get out of that position, which could lead to injury. And so some strength and conditioning coaches and clinicians would suggest a front squat just in terms of safety in that standpoint. But if we're talking just about the biomechanics in general, you're getting a little more torque on the knee and a little less torque on the low back and the hips. However, I want to point out that doesn't necessarily mean that the EMG activity is different between the two lifts. The EMG activity is similar, but you're getting less torque and less force put on those joints. So we're talking about compressive forces in that sense. So what are some front squat pros? One is increased VMO activity. That was an EMG study done by Hartman. And so that increased knee angle and increased torque on the knee led to an increase in VMO activity. Decreased range of motion on the lumbar spine and decreased loading on the hips. And then, as I just mentioned, similar EMG activity compared to the back squat. And then what are some of the cons? That increased pressure on the knees, which we discussed, increased torque on the knee joint. And then another issue that can come with the front squat is the wrist pressure. So some athletes who may have wrist problems may have a hard time getting in the position that was shown in those pictures. There are some variations of the front squat where you can use straps, or you can just keep your hands straight, or you can hold it differently so you're not getting that pressure on the wrist. So there are some variations that you can use, but the ones in the picture are the most common ones you can use. And then the other is typically results in less overall weight being lifted, and we discussed that with that decreased torque on the hip joint, you're able to produce less force, so that's less overweight being lifted. And some strength and conditioning coaches or athletes may feel that is a disadvantage, being able to lift less overall weight. So here's a case study. You have a 20-year-old basketball player diagnosed with patellofemoral pain. Athlete has been out for 2 weeks and is now cleared by team physician to resume full activity. In rehabilitation, they've been doing terminal knee extensions, straight leg raises, monster walks, clams, short arm quads, and physio-ball hamstring curls. So the athlete has front squats in their program. So what we'll do is we'll take out the front squats and replace them with back squats using the same weight to take pressure off the knee. So the reason that we would use the same exact weight is that if you take the same weight for the front squat and the back squat, so 200 pounds each or 100 pounds each with both squats, then if you perform the back squat, you'll have less loading on the knee with that same weight versus the front squat. However, oftentimes back squat results in greater weight being lifted. So if you were to lift, say, 150 pounds with a front squat, but then 300 pounds with the back squat, that loading on the knee might be the same between the two lifts. So it's important if you're going to make that change, that someone's having knee pain, we're going to put them on the back squat, that you tell them in that instance, well, let's stay around the same weight until you're assigned to symptom-free. So now we'll get into the trap bar deadlift. Trap bar deadlift is a great kind of go-between it's kind of a hybrid exercise between the deadlift and the squat. The squatting exercise is typically considered as a lower body push, where you're getting kind of the front musculature, where at the quads, the 4 quadricep muscles, the deadlift is often thought of as a posterior exercise where you're getting glute and hamstring activation. The trap bar deadlift is kind of a hybrid between the two, where you're kind of getting the best of both worlds there. So it can be used to replace kind of either one, a deadlift or a squat. So what are some of the trap bar deadlift pros? Trap bar deadlift appears to be a safer alternative to back squats at parallel. So in this EMG study, they compared activation of the erector spinae in the trap bar deadlift at 90 degrees. So this was at 90 degrees for both exercises, not going below 90 degrees. There was less erector spinae activation, so hopefully leading to less injury in the low back area. So essentially what that's saying is that for your low back region, the reason for this is you're able to hold the bar at the side as opposed to having the bar on your back, so that's taking a little of that loading off of the low back. And the other good part about this is that when you stand up, if you have any type of issue, it's real easy to just drop the bar and not have any type of injury. So there was no significant difference in muscle activation of the thighs compared to the back squat, so you're still getting the same activation even though it's a different exercise. There was significantly less erector spinae activation, which I talked about. This was a study done by Swinton et al., and this actually compared the deadlift too. So the back squat, the deadlift, and the trap bar deadlift, and there was less. The one that showed the least amount of erector spinae activation was the trap bar deadlift. And as I mentioned, the spotter is not needed, which is a good thing. Any lift where you need a spotter and there's an opportunity to fail where you need someone else to kind of assist you, there's going to be potential for some type of injury, because if you need a spotter and something doesn't go right, there'll be potential for an injury. And then compared to the straight bar deadlift or the common powerlifting deadlift, there was a higher peak force. So that means you're able to move the bar at a faster speed. And that has to do with the positioning of the bar, standing in the middle of the bar versus standing behind the bar in the deadlift. And what are some cons? It can be difficult to achieve greater depth. So as we mentioned before, the deeper the squat, they found better activation. For a trap bar deadlift, you're typically able to only get to about 90 degrees. But this can be great for beginners. So we have a beginner who hasn't done a lot of back squatting yet, or hasn't done a lot of deadlifting yet. Well, they can really only get to about 90 degrees. So it can be great for beginners. You know, they are stuck in that one motion. It's a fairly safe exercise as long as they're not doing too much weight. So it can be a great exercise for beginners or someone who's been kind of having an ongoing injury to keep them going. I've actually used it a lot recently in athletes who have some type of low back injury, where we're able to limit the amount of weight they put on the bar, and we're able to kind of control their range of motion and allow them to build some strength as well. But the thing that gets a little dicey is if you end up getting too heavy in this exercise, and that can be with any exercise that um, when form starts to break down, that's when you see some of those injuries take place. Another drawback of the trap bar deadlift is that the bar can really only be used for one exercise, and that's the trap bar deadlift motion. It's really not, there's not much else that you can use this bar for. So if you're at a college that has a limited budget, where they can only afford one type of bar, well, you're going to be able to do a lot more exercises with the straight bar, like than you are with the trap bar. So they'll probably pick the straight bar over the trap bar. And then the other is grip strength may limit some people, so maybe they'll lift less weight if they have a weaker grip strength. You are able to use straps to counteract this, but again, as I stated before, as that weight increases and then you lose grip strength, that form will break down. That's where you can get some injuries. So it's important to not try to get to a point where form breaks down in this exercise. So we'll talk about a case. You have an 18-year-old female lacrosse player, 6 weeks status post meniscectomy. Athlete has been cleared by team physician to resume full activity, but reports pain, discomfort with deep squatting. In rehabilitation, they're doing terminal knee extensions, mini squats, single leg squats, agility ladder, monster walks, step ups, and bird dog. So we'll replace, as I talked about, we'll replace back squats with a trap bar deadlift to limit that knee range of motion. And again, this is something I've used personally, clinically, based on this research, and I've had great success with it. And now we'll talk about the straight bar deadlift. And this is where, so in this picture, we see the straight bar deadlift from the floor all the way back, all the way up. So that is the full motion of the actual deadlift. And so what are some deadlifting pros? Weight lifted this is typically the most weight that an athlete can lift in any exercise. It would be higher than the back squat, higher than the trap bar deadlift, higher than the front squat, higher than all those exercises. Some studies have found increasing the amount you're able to deadlift allows you to increase the speed and the change of direction. There's a study done by Kynardall, so that the deadlift, being able to lift more weight in the deadlift, led to enhanced performance. And then greater hamstring activation compared to the trap bar deadlift. So the deadlift had the greatest hamstring activation, and that falls under that category of a lower body push. So deadlift being one of the best exercises for the lower body push, eliciting hamstring activation. And what are some of the cons? So you have increase in erector spinae activity compared to the other lifts, and that's an increase in erector spinae injury rates. And we know that low back pain can be a really debilitating injury, so that's something we want to be careful about. Increase in hamstring injury rates, so that extra load in the hamstring causing those hamstring injury rates. And we also know that that a hamstring injury, especially for a sprinting athlete, whether that's a track sprinter, a football player, a baseball player, etc., can be a really debilitating injury as well, where they may have to miss extensive amounts of time. So that's another thing we want to try and prevent. However, and I think in general the deadlift is in, like, the full motion deadlift is probably being phased out by a lot of strength conditioning coaches in some ways because of some of these increased injury rates. Interestingly enough, this lift has probably been around almost the longest, but I wasn't able to find a ton of information about it outside of what I just presented. But however, there are two alternatives to the deadlift, the Romanian deadlift, or the RDL, and the single leg deadlift, or the SLDL. And we have a couple videos to demonstrate those exercises, and I think that those are becoming more commonly used as deadlift variations now in trying to strengthen the posterior musculature And they're also exercises that are used in rehabilitation as well in the later stages of rehabilitation. So I'll talk about a case, a 19-year-old track spinner who complains of low back pain. In the athletic training room, he is getting massage, electric stim, rehabilitation, exercise for rotary stability and glute strength. The weight room exercise calls for deadlifts for that day, so we'll replace deadlifts with trap bar deadlifts to decrease the load on the low back. So they'll stand inside the bar in a better position, a more upright position, decrease the load on the low back, and that allow them to lift safely for that lifting session. So now we'll get into the rear foot elevated split squat. This is probably one of the most underused exercises, in my opinion, whether that's related to rehabilitation for a clinician or it's related to a strength and conditioning session. And you can see the full range of motion demonstrated in this picture where you have the athlete standing up straight, and then they go down into a squat and then back up. So what are some rear foot elevated split squat pros? One study, and this was the study that I talked about by Spears, it showed there was no significant difference in performance using the rear foot elevated split squat and the back squat. So what this study did was it compared a team of rugby players, kind of rugby players in Europe, and it compared every athlete did a rep max split squat, back squat. They also did a 40-yard dash and a 10-yard agility run. And at the end, so one group of the athletes did RV split squats for all of their exercises, and the other group of athletes did back squats. And at the end of the study, though, they retested and they found there was no significant difference between any of the variables. So this can be, a huge plus for the RV split squat in saying that it can perform just as well as the back squat. However, it could also be a positive for the back squat in saying, well, you don't have to do an RV split squat, you can get results in the back squat. So I think it could go either way with that, but I thought that was one of the probably early groundbreaking research studies for the RFE split squat, but there is more research that needs to be done on the RFE split squat. So you can hold the weight on your side and take the load off the spine. So this was a study done by Stastny et al. And the way I want to demonstrate this or try to explain to you how this works is if you have if you're taking a back squat and say you're doing 300 pounds on your back squat, that's going to be 300 pounds of weight on the spine itself. So that 300 pounds is sitting on your back. That's 300 pounds that your spine has to be able to stabilize, and then that's going to be, say, 150 pounds between each leg. Versus there's a couple of variations of ways you can do the RFE split squat, and one would be holding dumbbells. So let's say you had two 75-pound dumbbells. Well, that's because you're holding the weight on your side, you're taking that load pretty much completely off the spine. But let's say you have 150 pounds on your back performing the RFE split squat. That's only 150 pounds that your spine has to stabilize. So you're cutting that weight that your spine has to stabilize in half. And then you're essentially putting all that weight on each leg. So you're still getting the same force on each leg, but you're taking that load off the spine. However, I do want to point out that while both legs are doing the same amount of work, what they found was that 85% is on the front leg and 15% on the back leg. So it's not a perfect 100% on one leg. That back leg is still doing some of the work. So if you're doing, a 150-pound RFE split squat, you might not be getting 150 pounds on that front leg. It might be a little less. However, you know that if you do 5 reps with the right leg and 5 reps with the left leg, that you're getting the same loading on both legs, as opposed to a double leg squat where you're not sure exactly what the loading is between the two legs. And then, as I stated, the research is limited on the RFA split squat. I think more research needs to be done on this lift, comparing it to the other lifts to see, which one is more beneficial. However, I think it's just an experience that I've had some great results with this lift, and I think that idea that I talked about, a bilateral deficit, really plays a big role in why this lift is successful, because again, you're taking some of that load off the spine and you're able to make sure that each leg is doing the same amount of work, and I find that has does a great job with allowing athletes to get stronger, increase their performance, but also decrease that chance of injury. So now we'll talk about a case. This is actually a case that I had personally, so this is speaking from personal experience here. You have a 21-year-old male hockey player with an AC joint sprain grade 2. Athlete is unable to train using a barbell for at least 8 weeks. However, there's still 12 weeks left in the season. So this athlete's going to be out for 8 weeks, but there's 12 weeks left in the season, and that last 4 weeks is likely the playoff season. So if he's one of the better players in the team and he can return for the playoff season, well then, you want to have that athlete ready to be able to help the team in those important games in the playoffs. So in rehabilitation, he's doing passive range of motion, active range of motion for the first 2 or 3 weeks, and then returns to activities day lifting and resisted range of motion. So that would be, he returns to activities day living, he gets out of a sling or any type of restriction that he's in, and then is doing normal rehabilitation. So the athlete, for training, what are we going to be able to do with this athlete for the next 8 weeks? So I train the athlete using single leg squats and split squats for the first 2 or 3 weeks. So this, one way that you could do this is to use isometric holds, where you're unable to get as much weight on the athlete because they can't hold the weight with one of their arms. But if you do some isometric holds, you're still able to load the athlete and make them work without having that extra weight. And then once they're at a point where they can start holding some weight, you can go to the RFE split squat, where you don't have to necessarily load them too much, but you can get a lot of work from that leg. And that's actually what we did with this athlete, the exact scenario that came up last season. And fortunately for our team, this plan worked, and the athlete was able to return to play in the playoffs and help the team advance to the championship game. And this was the study that I mentioned earlier about academy rugby players. And I found this study to be really important, because it's one of the first studies to compare RFE split squats and a different type of squat, because there's a lot of debate between different strength conditioning theories about which one's better. There are some strength conditioning coaches who have gotten away from double leg squatting completely. There's others who only double leg squat, and there's others who are somewhere in between. So I think there's that definitely exists. And then you probably have clinicians who see athletes doing only double leg squats, which is like, well, why aren't they doing single leg squats? And you might have clinicians who see them doing only single leg squats, and they wonder why aren't they doing double leg squats. So this is a study to actually give some solid information and solid evidence to the different theories. Again, this is by Spears and his team about academy rugby players in Europe. We're half trained with the RFE split squat and half trained with the back squat. And again, no significant differences were found in the performance variables. And those performance variables were the RFE split squat rep max, the back squat rep max, the 40-yard dash, and the 10-yard agility run. So again, I believe more research needs to be done on this topic. So now we'll go on to the single leg squat. And there's a couple of different variations of the single leg squat. This is probably one of the most common ones, where you have someone stand on a bench or a box, and they lower that leg down, and then they'll stand back up. So you can see in this picture, the woman in the picture, she is lowering that leg down. Her leg's probably getting close to about 90 degrees. It's actually a lot more difficult than this picture makes it look, to be able to get down to like close to 90 degrees on a single leg squat. You'll see many of your athletes, when they start off, just from a balance perspective, that they'll have a hard time getting to even 45 to 50 degrees before they start to lose their balance. So this is a picture where, again, it's demonstrating the ideal the ideal form and the ideal squatter, but again, our athletes may necessarily not be able to perform this the exact way. So some single leg squat pros. In a study of ACL reconstruction patients, it was found that peak torque in single leg hop for distance was significantly greater in the uninvolved compared to the involved, which was compared to a control group studied by Ganell et al. So what does that mean? That means that the single leg hop for distance in the involved versus the uninvolved, there was a significant difference between the two. So that means that injured leg that had the surgery, there was a significant difference in the amount of force and that injured leg was able to produce. So as we talked about with that idea of bilateral deficit, that if you're training with only double leg squats and that leg is able to catch up and that leg's already behind, and that the uninjured leg will continue to outperform the injured leg, which having an injured leg be outperformed by the uninjured leg could lead to possible injuries further down the road or possible re-injury. It has been shown that single leg squats increase the recruitment of the glute med and decrease the overall risk of knee injury. This was studied by Gonzalo and his team, where so the glute med is a very important muscle in controlling balance, and it also helps control the knee falling in. So if you have greater balance, that you have the knee falling in during those squats and during the landing of a jump, that's where you can have some of that's where you can get some of those knee injuries. As the knee falls in, you have an increased twisting motion, or you put more strain on the MCL, or if you lose your balance, that's where you get hyperextension injury, where you can have an ACL injury. So the glute med being a really important muscle in the stabilization and the balance, and that's why that's going to help decrease those overall knee injuries. So the single leg squat is one of the best exercises for recruitment of the glute med, which is important. And then the Y balance test scores and single leg jump scores were significantly different between injured and uninjured. So what is a Y balance test? A Y balance test is essentially, it's like a star excursion, essentially, where you're sitting on one leg and moving the other leg around. So I think most clinicians are familiar with a star excursion. A Y balance test is essentially a variation of a star excursion, where it's a test that is used by some clinicians. It's also used in the Olympic Training Center as one of their baseline testing scores. And so essentially you're testing how well can they balance on that leg compared to the other leg. And what they were finding was on that injured leg, the scores were significantly down compared to the uninjured leg. So again, if we continue to train our athletes without trying to address those issues, that's when we can get increase in injury, and we're not fixing those issues. And without fixing those issues, we'll have a greater chance of injury. And another thing I actually want to talk about real quick is there's something that's becoming more popular among clinicians and strength conditioning coaches called the Postural Restoration Institute, where they talk about some of the imbalances that exist side to side. That's kind of the main theory behind the Postural Restoration Institute, is that there are imbalances between the two sides in how the anatomy of the body, how the structures sit, and how those muscles activate. That imbalances are normal and they do exist. And so if you have those imbalances and you don't try and fix them, their theory is that without trying to work on those imbalances, you'll lead to an increased chance of injury. So again, that's another pro on the side of single leg squats, where you're getting the same amount of work on both sides. And then what's common for single leg squat, that strength increases are not as great in single leg squats, because you're generally not able to load the body in the same way as you can with, say, an RFE split squat or a back squat or a front squat or a trap bar deadlift, etc. So strength increase in general won't be quite as much as you get in other exercises. And then, in general, if you're trying to get an athlete to increase their muscle mass by 10 pounds, 15 pounds, etc., without being able to load the body in that way, that can be difficult to achieve. So those are some of the cons of the single leg squat, being that maybe it's not the only exercise you can use, but it is an important exercise. And then I have 2 videos demonstrating the single leg squat. One is the one that in the picture that that was shown. So that is the one in the picture that was shown, where you have a single leg squat holding a weight, and you see what you're trying to do is prevent the knee from falling in. And then you have the single leg squat to bench, which is a variation of the single leg squat. This might be easier for an athlete who has trouble with the single leg squat, where they can actually sit down to a bench. It decreases their range of motion. It gives them something to kind of fall back on. So that's, again, another variation of the single leg squat that you can use if an athlete is having trouble with the single leg squat. So a case, you have a 19-year-old male basketball player who is diagnosed with a grade 1 ankle sprain. Four-way ankle, they're doing four-way ankle rehabilitation, the BAPS board, ABCs, balance training. So replace double leg squats with single leg squats on the uninjured side. Have the athlete single leg squat on both sides, what the athlete can tolerate on the injured side. So there is a crossover effect where if you're having an athlete do single leg squats on the right leg, you get a small increase on the left leg as well. So there is a crossover effect, and that's well documented, well studied. So in the short term, you have an athlete, maybe they're going to be out for a week. It can be a good idea to have them single leg squat on that one side, and then the next week have them single leg squats on both sides once they're able to tolerate it. And the Olympic lifts. And these are I want to talk about the Olympic lifts a little bit. Studies show that for athletes, it may be more beneficial to train at lower loads to have the most transfer to athletic performance. This was studied by Garhammer et al. So the 2 common Olympic lifts are the snatch and the clean and jerk. And so I think one of the most common ones that's used is the power clean. And I have a video of the power clean. Just to demonstrate what that looks like. A lot of times it's done from the hang, and you can see it's just a kind of explosive, fast motion. That's, in general terms, that's probably the most common one that you will see in a strength and conditioning session. There are strength and conditioning coaches who will use jerks and we use snatches, but I'd say by far the hang power clean is probably the one that's used the most. And studies showed that for athletes, it may be more beneficial to train at lower loads. So if you're comparing a competitive Olympic weightlifter to an athlete, so a competitive Olympic weightlifter, so someone who's trying to go to the Olympics, for instance, or trying to win the Olympics, for instance, they're really, their main goal is to try and lift the most weight they can possibly lift. So for instance, this is that last picture had a Chinese weightlifter who, this is actually from the Olympics. I believe he actually was a gold medalist at the Olympics as well. But you can see the amount of weight that he has on the bar, and his main goal in this lift is to lift this weight in any way possible. So the max speed, everything that is the most important thing is trying to complete this lift to get that gold medal for this athlete. Whereas in an athlete who is a basketball player or a football player or a hockey player, etc., the list goes on, their goals are going to be a little bit different. So for those athletes, moving at a lower weight where they can move faster can have more crossover to them athletically on the field than trying to move a heavier weight slower. So, and that's kind of just a point that I want to reiterate. That's important to be able to realize, is that it doesn't matter the speed necessarily. I mean, Olympic weightlifters in the Olympics are moving fast. So, trust me, if you watch those lifters, they're moving fast. But the point being, if you take someone who's, not well trained and have them move a heavy weight, they likely won't move that weight at a high velocity. And what you want from your athletes, if you're going to use Olympic lifts, is you want them to be able to move those weights at high velocities. So you want to use a weight you want to pick a weight that they're able to move at a high velocity, and lower weights will help them transfer that better to the athletic field. Some studies have found that using a power clean in place of jumping exercises led to an increase in vertical jump. This was by Hackett et al. So where they had one group only do jump training, and another group did jump training plus Olympic weightlifting, and they found that the Olympic weightlifting group had an increase in vertical jump. Some studies have found an increase in 40-yard dash time compared to a control group. So I believe in this study it was a group who did just sprint training versus a group who did sprint training plus Olympic lifting, and they found the Olympic lifting group increased their performance better. And then, as I just discussed, the injury rate is really low if you're trained properly. So if you compare, Olympic lifting to, other activities, the injury rate is actually pretty low if it's done properly and it's done at a low load. However, there are some cons to this, because if when compared in studies that looked at the Olympic Games, the Summer Olympic Games, which the Summer Olympic Games are where Olympic weightlifting takes place, and they compared, Olympic weightlifting, there were injuries in Olympic weightlifting. However, this goes back to kind of the injury paradigm that we talked about earlier in that graph, that those Olympic weightlifters who are trying to lift the most weight possible to win that medal, their training volume and their training load is excessive. But it has to be excessive for a reason, because they're trying to lift the max weight possible. So you can't possibly lift the max weight without having an excessive training load. When you have that excessive training load, you're going to potentially have some injuries. So yes, injuries do potentially take place in Olympic weightlifting at the Olympics. However, as long as you're training your athletes, your sport athletes, in a smart way, where they're not having excessive load, the Olympic lifts, especially the power clean, can be a very safe exercise. And the other positive to the power clean compared to the snatch and the clean and jerk is that you don't have to stabilize any weight overhead. So without having to stabilize the weight overhead, you'll have a decrease in that rate as well. And so in summary, for the return to play, back squats create more torque and angle on the low back and the hips. Front squats create more torque on the knees and also greater VMO activity. Trap bar deadlift found to be much safer than deadlifting and elicit similar thigh activity compared to the back squat. RFA split squat found to be as efficient in performance as back squat. Single leg squat found to be important in glute med control and knee injury prevention. And Olympic lifting found to be more effective in increasing vertical jump than a jumping program alone. So those are some of the key takeaways from the return to play portion of this presentation. And now we can get into the injury prevention side of the presentation. So I thought that this picture was actually, pretty interesting. This doesn't relate necessarily just to athletics, but you can see the word injury prevention, and then you see so many other words put in there. So injury prevention is a pretty complicated topic, as far as so many different factors can contribute to injuries. And we know that, a psychological factor, what's going on, with the athlete, what's their stress level with the athlete, what's the athlete doing in the 20, I call it the 22-hour rule. What's the athlete doing in the 22 hours they're not, at practice or performing a strength and conditioning session or with the athletic trainer? All those different things relate to injury prevention. So I just thought this was kind of a cool picture to kind of demonstrate how all that, can play a role in injury prevention. And here's a quote from Brajesh Patel, who is the head strength and conditioning coach at Quinnipiac University, where I went to undergraduate school. And he said, I am not a big fan of the use of the phrase injury prevention because you can't prevent things from happening. Only God can do that. However, we can reduce the risk of these injuries from taking place. So I thought this is actually a pretty cool quote from Brad Jess that really we're trying to reduce the risk of injuries taking place. Can you really prevent anything from happening? Well, we're not sure we can actually do that. If you look at the research, I don't think there's anyone who's been necessarily smart enough. Well, and I certainly don't think I'm smart enough to prevent things from happening completely. And especially if you look at ACL prevention programs where you're reducing the risk of overall knee injuries, but can you prevent an ACL injury from ever taking place? No, you can't do that. So I thought that with you, and especially when you're talking to your coaches and talking to other clinicians, etc., and your athletes, I think it can help you to use the word reduce the risk of these injuries as opposed to prevention. Because, for instance, you could start a ACL prevention program where you had 10 ACL tears the year before, and you could get that number down to 3, but a coach might say, hey, we still had 3, so you're not preventing these from taking place. So I think reducing the risk can help you as opposed to just using the word prevention. So what can we reduce the risk of? What I'm going to talk about in this presentation that we can try to reduce the risk of is ACL injuries, rotator cuff injuries, and low back injuries. So those are the 3 main things that we'll discuss on this side, trying to reduce the risk of those 3 things. So you have an upper body, a core, and essentially an upper body that will go over a core and a lower body. So what are the rate of ACL injuries? College athletes are at the highest risk for non-contact ACL injuries. So what's a non-contact ACL injury? And those are really, non-contact injuries are really what we're trying to reduce the risk of. It can be difficult to reduce the risk of a contact injury taking place, like someone who gets grabbed at the ankle and then gets hit and their knee goes one way and their foot goes the other way. Those can be difficult to prevent because of you may have 2 big football players who both weigh 230, 300 pounds pulling on your leg. It can be difficult to train in a way that's going to prevent that injury taking place. However, those non-contact injuries where they're not being hit by another player or not making contact with another player, those are the ones you really want to try and reduce the risk of. 85% of ACL injuries in male professional football players resulted from non-contact and indirect contact mechanisms. So, and by football, I believe in this specific study, they were talking about soccer. So football being European soccer, being so this was related to soccer and not necessarily football, American football. However, 85% of injuries being from non-contact to indirect contact mechanisms. So that indirect contact might be just jumping up and bumping somebody else and then landing, but just that bump while you're in the air throws you out of position and you land in a fight position and get injured. So you can see there is a large portion of injuries that we can try to reduce the risk of. It's not just that people get injured in the contact way, it's the non-contact and indirect contact that we want to reduce the risk of, and that we really can make a big impact. So who has the highest risk of knee injury rates? For ACL injuries, women's soccer had the highest rate, followed by football, women's basketball and volleyball, men's soccer, and men's basketball. So interestingly enough, in this case, women's sports, other than football, had a high rate of ACL injuries. This has been documented in many studies where the Q angle at the hip causes it, has an impact on the angle of the knee, and that leads to those increased injuries. Interestingly enough, there's also a hormone that's released during the menstrual cycle that's called relaxin, and there's been some speculation on whether when this hormone relaxin is released, and that hormone relaxin actually causes the ligaments to lose some of their tension, and that's the reason for that is that it's supposed to act on the hips to be able to relieve some of the tension in the ligaments in the hips for childbirth. However, it does impact all of the ligaments in the body. So if you're playing a sport, when that hormone is released, it can, there is some speculation on, can that play a role in some of these injuries that take place? And in general, like, there's nothing you can do about this hormone being released. You're not going to alter the hormone. However, it's understanding that this is taking place, and then understanding, okay, how can we train, or what can we do to try and decrease the injury rate, knowing that some of these things are going to take place. So that's really what's important to take away from this. And then for any knee injury, football became first place over women's soccer, women's basketball, volleyball for any knee injuries. That could be patellar tendonitis, it could be an MCL sprain, a meniscus tear, etc. And then now it's followed by men's soccer, men's basketball again. So how do ACL injuries occur? Contact would be colliding with the player. Getting tackled, you can see in the picture of the football player, that player is being contacted right at his knee level, and that can lead to a knee hyperextension. One of the more common, famous in New England, knee hyperextension injuries that took place was Rob Gronkowski a couple years ago. And then landing on someone, going up. So, for instance, a basketball player or a soccer player, they go up for a rebound or a header, and they come down, not on the ground, they land on somebody's foot, or they land on another body, and that can lead to that hyperextension injury as well. And then you also have non-contact injuries. So this is when that athlete describes getting stuck in the turf. They land and nobody else is around them, and they go down. The athlete who is cutting, pivoting, hyperextending, and there's nobody else around them, but they get stuck in the turf, etc., and they have that injury. So these non-contact injuries, the athlete who says, oh, I just got stuck in the turf, or I was running, no one was around me, I just fell, etc., these are the ones we want to try and really reduce the risk of. So predisposing risk factors. As we talked about, females more likely to suffer an ACL injury when compared to males, and in relation to that genetic makeup, the valgus varus and the Q angle, which you can see demonstrated in this picture, where the knee falls in. Other factors include neuromuscular fatigue, which leads to slowed reaction times. So this could be related to overtraining. Again, we go back to that paradigm in the graph, where you have at excessive training loads, you'll have an increase in injury rates. So at excessive training load, you're going to have neuromuscular fatigue. Neuromuscular fatigue leads to a slowed reaction time, and a slowed reaction time is going to lead to an increase in those instances of someone getting stuck in the turf or trying to cut and not being able to react, etc. So that's an important thing to talk about, is that excessive training load is going to be a role in these injuries as well. So what is an ACL prevention program? ACL prevention programs are designed to increase balance, proprioceptive strength, and speed. So this was stated by Oe et al. And this was a study they did on soccer players, and they stated that the goal of the ACL prevention program is to increase balance, proprioceptive strength, and speed. Some common ACL prevention programs are Sports Metrics, which is Sports Metrics is a certification that a clinician can take. This Sports Metrics is often best utilized in a one-on-one scenario, where a clinician is working one-on-one with an athlete to try and prevent an ACL injury, or someone is coming back from an ACL injury. It's a great program. I looked into it. It's a great program. It focuses on these things I talked about before. But again, it's really tailored to the specific athlete, and it's great in a one-on-one setting. There's also Prevent Injury, Enhanced Performance, which is similar, and then the FIFA 11 Plus, which the FIFA 11 Plus is a specific program. A couple years ago, at Endicott, I was looking into starting an ACL prevention program with all of our athletes across the board. And we ended up deciding, after looking into all of the options, was we chose the FIFA 11 Plus because it was easy to implement the FIFA 11 Plus with all of the athletes. in a big group setting, which is what we needed. That was kind of the demand that we had. So that was why we chose that. However, it didn't mean that we thought that program was necessarily better than those other programs. We thought it would just work better in relation to having a large group versus being able to work one-on-one. But I think, Sports Metrics is also a great program, and if you have someone Sports Metrics certified on your clinician staff, that's a huge benefit to you as well. So what is the FIFA 11 Plus? The 11 Plus is designed to be built into a warm-up before training sessions 2 to 3 times per week. It consists of 15 exercises that include running, agility, balance, core, and plyometric exercises. It takes about 15 to 20 minutes to complete the entire program. It was found a significantly lower incidence of injuries in Nigerian male soccer players aged 14 to 19. So that's oftentimes the population that we see in high school versus the beginning of college. And that study was in male, but you saw a decrease in those total injuries. Similar results in American male NCAA Division I and II players aged 18 and 25 when performing the program regularly 2 to 3 times per week. And that was a study by Silvers et al. So you see a large, again, this was in males. However, you see a large age population, 14 to 25 years old there, that's saying that the 11 plus resulted in decrease in those overall injuries. So part 1 of the program is very easily built into the warm-up. You have running straight ahead, running hip out, running hip in. So the running hip out is where you pick your leg up, move to the outside. The other is pick your leg up, move to the inside. So those are just some different parts of part 1. These are easily built into a warm-up, and it probably takes about 5 minutes to complete this first part. So say as opposed to doing just a basic jog, we're going to jog around the field 2 times and get our bodies going before we stretch, you could do this series, which takes 5 minutes, and you're going to get the blood flowing to your athletes, and you're not going to take up any more of their time, and you're going to do something that's beneficial to them. So that's just an example of how you can take a basic warm-up where you almost see, I see every day when I go to different practices, whether it's at high school or in college, that they'll get there and they'll say, all right, everybody run around the field twice, or everybody jog around the field twice, just get the blood flow going. Well, maybe instead of jogging around the field twice, we can do this instead and have a little bit of a better impact on our athletes. And I have a couple of videos just to demonstrate a couple of these exercises. So this is the circling partner where you see they're using their peripheral vision. That's another important piece, is being able to use your peripheral vision when you're on the field to decrease the chance of injury, being able to know where you are in space. So that peripheral vision, that proprioception. And then our other video, this just includes some shoulder contact, so getting used to, having contact and landing in a good position. So part 2 consists of some core exercises. A plank, they start at 3 times 20 seconds. And then a way to increase that is a plank with one leg up. And then you can do a plank with your legs switching sides. And then a sideways plank where you can, and a way to progress that is a plank with a hip raise and a plank with one leg in the air. Core strength, in general, everything starts from the core. That's going to be an important piece to try not to forget. And again, I think another thing that helps you is that coaches tend to love, athletes doing core work. I think you see countless times at the end of a practice, they're saying, oh, everybody get in a plank position or everybody do some sit-ups or whatnot. Well, maybe this is an easy way for you to say, well, we're going to take them through some core work at the end of practice. And, coaches tend to, it's usually an easy sell for coaches. And, you can have, the good thing about the FIFA 11 Plus is that you can have different athletes in a big group progress different ways. So if you have one athlete who struggles with a plank and another athlete can plank for a long period of time, you could have, 5 of those athletes doing a double leg plank, 5 athletes doing a single leg plank, and 5 athletes doing a plank where they're switching legs. And then with the sideways plank, you can do the same thing. One can hold it. Another athlete could be doing hip raises. Another athlete could be doing it with one of their legs in the air. So you can progress the athletes in a large group all together, and it kind of works pretty smoothly. And that's kind of one of the good thing about this program that I like, that it kind of worked in a group setting. And then part 2 continued. You can call these partner hamstring lowers. I've also heard them called Nordic hamstring exercises, where one partner is holding the feet of the other partner, and then they slowly lower down. And this is a great, exercise that's been shown to decrease hamstring injuries, but also having that strength of the hamstring, trying to prevent some of those hyperextension injuries from taking place. Single leg balance, holding a ball, squats with toe raises, and vertical jumps. So one thing that I found to be important is teaching an athlete how to jump properly, and that starts with 1, knowing how to squat, but 2, knowing how to squat and come up on your toes. An athlete being able to learn how to squat, come up on their toes is almost essential before they even start to jump. Being able to squat in a good position is going to be their landing position, and then come up on their toes is that first position before they jump. And from there, you can go on to vertical jumps, where they come up on their toes and actually jump, and then land back in a good position. So I like to break it down into sections where it's okay. First is the squat, and the squat's going to be your starting and your landing position. Secondly, you're coming up on your toe. Thirdly, you actually go into that jump, and lastly, you'll go into that landing position. So I think breaking it down and working on those different phases, just like you would work in a practice or any other exercise where say a core exercise where you're going to teach them how to stabilize their core first. I'll treat jumping the same way, where let's talk about the basics of jumping, like break down each one before we can put it all together. And we have a couple more videos. So notice on this video that you see the athlete's doing single leg hops, and you see that when he's landing, he's trying to prevent his knee from falling in. And that's the important piece on control. And now we'll move on to the other video, which is double leg jumps. And you see he's moving different motions, which is common to what you might have to do in a sport situation. And I think the important piece of this program in general is trying to take, your rehabilitation session and the strength and conditioning session and try and make it a setting where it's transferable to the field. And these are some ways we can try and do that. Then part 3, you have running across the pitch, which is essentially acceleration, bounding, single leg bounding, or jumping leg to leg, and then plant and cut. And we'll demonstrate the plant and cut right here. And here's a simple warm-up exercise that you can work into your warm-up very easily, and say instead of just doing a very simple acceleration or a simple exercise, you can have a plant and cut where your athletes are working on this phenomenon. But it's real easy to do in the warm-up. It's not taking up any more time of the coach's practice. I think that's another major piece, is that coaches will say, oh, well, I just don't have enough time in the day. Like, I only have an hour and a half, or I only have 2 hours, and they view that time for their practice as so special that this is the only amount of time we have, and I have to get everything done in this amount of time. So finding ways to implement these programs while not taking up much more of their time, I think, is another important piece, and this is kind of an easy way to do that. So now moving on to shoulder injuries in the overhead athlete. So what are some common injuries in the overhead athlete, and baseball being a major sport where you have injuries in overhead athletes? You can also have the same thing in throwers of the javelin and potentially the discus as well. And potentially tennis players too. So you can have rotator cuff tendonitis, biceps tendonitis, subacromial impingement, ulnar collateral ligament sprains, bone spurs, and tears of the shoulder labrum. Just a quick review of the rotator cuff anatomy and the scapular anatomy. We see the supraspinatus and infraspinatus on the left side of the picture, and then the subscapularis and the teres minor on the right side of the picture. So we can see a general anatomy of the rotator cuff compared to the scapula on the right side picture, where you can see the rhomboids, how the rhomboids sit in between those muscles, and those being and the trapezius as well, being important muscles that control the scapula. You really, when you break down the anatomy of the shoulder and what's important in the shoulder, the scapula muscles, the rhomboids, and those traps are going to be, and the serratus anterior, are going to be really important in stabilizing the scapula, and then that's going to become very important in allowing those rotator cuff muscles to do what they're supposed to do. So going over quickly the physiology of throwing. During the action of throwing a baseball, the humeral head glides and rotates on the glenoid fossa. The glenoid labrum is only able to withstand a limited amount of force on its own. The rotator cuff muscles must provide the structural support for repetitive throwing to be able to take place. Certain studies have shown that delayed subscapularis activity has been correlated with injuries in overhead athletes. That was a study by Hess et al., where a delayed subscapularis activity correlated with increased injuries in those overhead athletes. Now going back to the scapula during throwing. During maximum humeral elevation, the scapula normally upwardly rotates 45 to 55 degrees. Posterior tilts 20 to 40 degrees, and externally rotates 15 to 35 degrees. So you can see that there's a lot of things that need to happen in the scapula during throwing to take place properly, and you can get pretty finite in these motions, and without a specific tool or specific kind of way to measure this, it's going to be hard to know exactly what's going on the right way, but it shows the importance of the scapula. Retraction of the scapula during humeral head elevation has shown to increase the subacromial space and increase supraspinatus force production. So in that phenomenon of impingement, where the subacromial space becomes decreased, we want to be able to increase that subacromial space and prevent impingement and allow the supraspinatus to do what it's supposed to do. The serratus anterior stabilizes the medial border of the scapula, helping to prevent scapular winging. And that was a study by Escamilla et al. So it shows the importance of the serratus anterior in being a stabilizer of the scapula, where we want to prevent that winging from taking place, which is going to lead to many issues. So a typical thrower's tendon program, and this should just be something general you can put together of basic exercises that a clinician can put together. Prone and standing flexion, prone and standing horizontal abduction, flexion, scaption with internal rotation or your full can exercise, scaption with external rotation or your empty can exercise, scapular push-ups, internal rotation and external rotation at 0 and 90 degrees, scapular retraction, and scapular punches. One thing I wanted to touch about was the scaption of the empty can exercise, scaption external rotation. There are studies that have found that empty can exercise does decrease the subacromial space. So that's an exercise I've started to phase out in my programs because, if it decreases the subacromial space and puts them in an impinged position, and what would be the point of putting an athlete in an impinged position, having them do an exercise when impingement is what we want to prevent. So I've started to phase that exercise out of my programs. And then you have an idea we touched on a little bit earlier was the idea of bringing the athletic environment to the athletes in a clinical setting. And one way that I have done that in the past is by using a Bosu ball, where we try to get some core activation with their exercises. So we take some basic exercises like flexion, horizontal abduction, internal rotation, external rotation, etc., and we try and we have them stand on a Bosu ball, so they have to work on their balance, increase their core activation, and also learn to use those muscles while they're using other muscles in hopes that transfers to the athletic environment in a better way. And this leads us to kind of an advanced throwers 10 program, where you can have them stand. In this advanced program, we had them stand on Bosu balls, but you don't necessarily have to have them stand on a Bosu ball. But the idea of isometric hold. So what we would do is for the first set and the second set and the third set, we wouldn't have them do the exact same thing. Each set would be a little bit different. And so the first set would just be a normal bilateral contraction, so your normal flexion exercise, horizontal flexion, your normal exercise. The second set, though, will be an isometric hold. So you'll be holding your right arm out at the side while the left arm is doing, your flexion exercise, and you would switch. The left arm would stay out to the side, and your right arm would be doing that. The flexion. And then on the third, it would be an alternating. So you put both arms out in the scaption position for scaption. You would do the rep with your right arm, then do the rep with your left arm, and go back and forth. So you can see how once an athlete has a base strength, they can move on to those advanced exercises where you're going to get more muscle activation by having those isometric holds and increasing strength in that way. And one thing that's important to point out with these advanced exercises is that if you're using a Bosu ball, the Bosu ball helps create the athletic environment by increasing your core activation. However, you're not necessarily making the exercise more difficult on the shoulder in terms of recruiting more motor neurons or more muscle activation. It's going to be the same. All you're doing is you're getting that core activation to make that a little bit more difficult and make sure you're preventing postural sway, etc. And then the idea of sport cords. And I actually have a video about crossover symmetry that uses sport cords that we can play, and we'll demonstrate the importance of using sport cords to strengthen the shoulder as opposed to just your general TheraBand. With some common exercises that you can use with sport cords would be 99 external rotation, a row, scapular retraction, reverse flies, and scapular punches. Those would be common exercises you can use with the sport cords. So going over a case. And this was something that we did when I worked with a baseball pitching staff when I was on the athletic training staff at UMass Lowell. When we did this in conjunction with the strength and conditioning staff, where the pitchers on the team, we had starters and relievers. So the starters, on the day of their start, did sport core exercises. 2 days after their start, they also did sport core exercises, and then 4 days after the start, they did rotator exercises along with rhythmic stabilization. So the way it would work is that on the day of their start, they would do 1 set for activation before they start, then they would warm up, pitch, and then after they finished, they would do 2 more sets to get their kind of the rest of their workout in. And then 2 days after their start, they would do a normal routine of sport core exercises or those scapular exercises, and 4 days after their start was when they would do their rotator cuff exercises, general rotator cuff exercises. The reason for that is that in college, you typically are playing games, Tuesday, for us anyway, it was Tuesday and then it was Friday, Saturday, Sunday, or it was Tuesday and a doubleheader Saturday and a game on Sunday. So each pitcher was essentially pitching the same day each week, so we're getting 7 days of rest. So we would choose to do our rotator cuff work 4 days after the start so that they could recover from their start, get their rotator cuff work in, recover from the rotator cuff work, and then go into their start. And with the relievers on game day, because a reliever can be pitching on any day, you really don't know exactly when they're going to be pitching. They would do their sport core exercise in the same way that the starters did. So when they got ready to warm up, they would do their exercises for 1 set. At the end of their start or the end of the game, they would do 2 more sets. And then midweek, so that would be Wednesday or Thursday, in between the games, they would do their rotator cuff work along with rhythmic stabilization, just like the starting pitchers did. And for document injuries in 2013, and this was the year before that we started this program, in elbow injuries, we had 5 elbow injuries, 11 shoulder injuries, and 9 missed appearances from our starting pitchers. In 2014, where we did utilize this program, and it's important to note that they did have the same exact starting pitching staff between those years, so that did play a role. That we had in 2014, they were able to reduce the elbow injuries to 2 elbow injuries, reduce the shoulder injuries from 11 to 4, and the missed appearances from 9 to 1. So I think that's pretty significant to say that we're able to reduce those injuries and show some empirical evidence that this does seem to make a difference. And now we'll talk about core stability. So what is core stability? Core stability is extremely important, really, in decreasing any injury. It's important in the upper body and the lower body. Again, talking about that idea of postural the Posture Restoration Institute, what they theorize is that everything starts from the core, and those imbalances start in the core, and then they affect the rest of the extremities, whether it's down, to the knee and the lower leg, or whether it's up in the rib cage and then out in the upper body as well. So, first, lumbar instability. Lumbar stability exercise in conjunction with general core strengthening exercise were found to be more beneficial than exercise alone. So what that means is your general core strengthening exercises might be like just doing like a sit-up or reverse sit-up, etc., something like that, versus doing, planks and stabilization exercises, pelvic tilts. They found that those two together were more beneficial than in lumbar stability. And core stability exercises were not found to be any more effective alone than general core exercises. So just doing one, this was studied by Javidin et al. So what they're illustrating is that just doing one or the other, like say we're not gonna do any general core exercises. We're not gonna do like leg raises. We're not gonna do sit-ups, reverse sit-ups. We're just gonna do a Russian twist. We're just gonna do general core stability exercises. What they found was that it's not good to pick one or the other. They really work well together. So your core stability exercises like your planks, pelvic tilts, dead bugs, etc., in conjunction with your general core exercises like sit-ups, reverse sit-ups, leg raises, etc., putting those two together is when you're going to get the best results. And then talking about the transverse abdominals. Increased transverse abdominal thickness may be beneficial in patients with low back pain. So the the transverse abdominal muscles being important to be able to stabilize the spine, and in stabilizing the spine, it being important in disc health, so decreasing that chance of low back pain. And core stability exercises in conjunction with massage was found to be more effective than massage alone. And this was in treatment of the low back pain where they treated with massage. They found that if you just massage and then hope that it gets better versus massage and doing rehab, the rehab helps. So I think the important thing to note is that it's important to put all of this stuff together, general exercises, core stability exercises, and treatment, and putting those together is when you're going to get the best results versus just trying to hit one or the other. So what are some stability exercises? You have tall kneeling, lifts and chops, belly pushes, pelvic tilts, dead bugs, bird dogs, multifidus lifts, leg lowers, and balance training. Those are going to be your kind of stability exercises, and then your general strengthening. I think a plank can fall either way. It all depends on how you're doing it too. There's certain planks, like planks where you have one leg up in the air, or rotating legs, or have one arm in the air. That might fall more under stability. And then you have planks where you might have like two 45-pound plates on your back. That might fall more into general strength. And then you have sit-ups, leg raises, your glute ham, or your Nordic hamstring exercises, back hypers, med ball throws, and windshield wipers. Those are going to be general strength exercises. So trying to put the two of those together and get the best results possible. And now we'll go on to movement screens. So the constant battle of stability versus mobility, which one's better? Do you need more mobility or do you need more stability? And how do you find the balance between the two? Movement screens can be a great way to try and determine how much stability you have versus how much mobility you have, and trying to balance those two. We've started to use movement screens and Endicott more regularly amongst all of our athletic population. We don't use one specific movement screen. We kind of made up our own just based on different types of movement screens. There's a lot out there. I think in general, as long as you're doing something, it's a good thing. I don't think it needs to be one specific screen over the other. We'll talk about movement screens a little bit now. So movement screens were found to not have a direct link between the scores on the test and certain injuries. So what does that mean? that means that just because if you do, say, a hamstring flexion test in a movement screen, which is in the functional movement screen, just because someone has a decrease in that range of motion doesn't mean that they're 100% going to injure their hamstring that year. So we can't say just in looking at that test, okay, you're going to get injured. Is there a potential that they would have an increased risk of that injury? Sure. But there's really nothing yet to say that, okay, you have this score on this test, so a score being like a 1, 2, or 3 that they might get in that test, okay, you have this score on this test, so you're going to get injured this way. There's really no correlation between that yet. Part of that has to do with that one scorer may have an interpretation of a score that another scorer may find different. So you as a clinician may look at a score and say it looks like a 2, and another clinician may say it looks like a 3, and someone else could look at the same one and say it looks more like a 1. So I think there being some issues there can relate to that. Movement screens, but movement screens were reliable in testing what they were testing for. So for instance, if you were doing a shoulder mobility test and they get a 1 on the shoulder mobility test, that they have poor shoulder mobility. So and also, if an athlete tests poorly on rotary stability tests, they likely have weak core stabilizers. So they are testing what they say they're testing for, but it's hard. What you can't do is you can't say just because someone gets a score on a certain test that they're going to get this exact injury, because that's something that hasn't been proven yet. The functional movement system is one of the most popular ones that's used, and those here are the seven tests in the functional movement screen. One is an overhead squat, where you hold a stick overhead and squat into a position. One thing to note on that test is that it is okay to wear an Olympic weightlifting shoe or to have a heel lift and still get a perfect score on that test. So they do allow that on this test in this system. The next one is a stepping test, where you're looking at can they stand, pick their leg up in control, and you go side to side on that. The next one is an inline lunge, where you're looking to see if they can lunge down in the same depth on both sides and stay in line. The next one is a shoulder reaching test, where they're reaching behind them and trying to touch their hands together. You see a lot of males who have bulky muscles who struggle with this test. You can see in the picture you have a male here who can't get that close, his hands that close together. A lot of times, athletes who have not as much muscle built up, they'll be able to touch their hands together. You might have this with like tennis players, etc. The leg raising test is the one that I talked about on the previous slide for the hamstring. And then the push-up test, where you're just trying to see if they can maintain that position, and the rotary stability test. So those are the 7 different tests in the functional movement systems, and in the movement screen that we are currently using at Endicott, we're using some of these tests, and we also implement a couple of our own tests as well. So a case. So every athlete on the team is tested using the functional movement system by the strength and conditioning staff. The strength and conditioning staff gives a copy of the test to the athletic trainer to keep in the athlete's file. The athlete suffers an ankle injury and will be out for 1 month. The athlete scores low on the overhead squat test and the rotary stability test. So now that the athlete's going to be out for 1 month, the athletic trainer can go to the athlete's file and pull their sheet, and they can add into just the general ankle rehab exercises to incorporate mobility and core into the athlete's rehab over the next month. So instead of only working on the ankle, they can try to fix some of those issues that the athlete might have. And that's one way that you can utilize the movement screens. Another way is, if an athlete scores poorly on the hamstring flexion test and they do happen to injure the hamstring that year, well, after your rehabilitation program takes place, you can retest them and hope to see that those scores are increasing. And the other way that it's used with strength conditioning staffs is that what they hope to see in general is is you're looking at the whole score of all of the entire team, and you have to train to your weakest link. So if you have athletes who are scoring low on certain scores, so they might score low on the shoulder mobility test, you have to incorporate work that's going to help increase their shoulder mobility. So for those athletes, they'll say they test in the fall semester of their freshman year, and then they test the end of their spring semester of their freshman year, and again in the fall semester of their sophomore year. You're hoping to see over time that you're having increases as they get older and better test scores. So that's another piece that you can use those functional movement screens for. So in summary, ACL injuries can help reduce the risk of all knee injuries. Increasing the strength of supraspinatus, subscapularis, and serratus anterior helps to reduce the risk of impingement. Increasing core stability along with general core strength helps to reduce low back pain. The FMS is a reliable test, however, it is currently difficult to create a link between test results and certain injuries. And so, kind of as a practical application, just talking in general, just kind of to finish up, I thought this was kind of a cool, just a cool little picture to demonstrate. This would be just a typical workout, but you can see in the top you have a lower body strengthening exercise, and an upper body strengthening exercises. But then you also see stability ball, a stability ball exercises, dynamic cable chop. So you see how these different exercises might all work together, where you're trying to strengthen and also stabilize at the same time, where you might have some rehab exercises being incorporated in with some general strength exercise in a strength conditioning program. So I wanted to just kind of show this slide and demonstrate how one workout might be set up, and so that you could have a picture of how that might look. And that's pretty much wraps up my presentation. Again, thank you for listening.